More than 70% of the nation's nursing homes are now owned by for-profit companies, often backed by private equity or real estate investors. New research is raising troubling questions about their quality of care. CBS News contributor Lisa Ling first encountered these questions through her own family's experience, but soon found out she's not alone. Here's tonight's Eye on America.
This is Berkeley East, a for-profit skilled nursing facility in Southern California, where my 92-year-old mother-in-law, Grace Song, spent a month after a hospitalization.
When you go through all this stress, I'm just so deadly tired.
I began recording her during my visits after she told me she struggled to get the attention of staff. And medication she says she was told to take promptly at 8 a.m. routinely came hours late.
So then you're starting to panic because so much time is
passing by. So I was pushing the bus to find out what's going on.
One night, my mother-in-law, who was a fall risk, was left alone in the bathroom and fell. She hit her head and was sent back to the ER.
This is where you feel, how did I get to be so helpless?
More than 70% of U.S. nursing homes are now run by for-profit companies, and there's growing evidence patients are paying the price. Harvard professor David Grabowski is an expert on nursing home policy.
The vast majority of quality problems in the U.S. are centered in for-profit nursing homes.
Most U.S. nursing homes rely on taxpayer money from Medicare and Medicaid. Grabowski told us as profit-seeking investors have poured in, it's become more difficult to track where the money goes.
We really don't know kind of how they're using public dollars and whether they're actually going into direct resident care.
What is clear from federal research, many of these facilities have been found to have lower staffing and worse quality of care. In 2019, Berkeley East was taken over by a for-profit company called Aspen Skilled Healthcare, a mid-sized chain of more than 24 nursing homes.
How often were you exposed to examples of gross negligence?
It felt like on a daily basis.
This nurse, who asked to appear in shadow, left Berkeley East after working there more than a decade. She was one of 5 current and recent former employees who told CBS News patient care had been compromised after Aspen took over.
What would you say the biggest changes were?
When we try to call upper management, they wouldn't even pick up the phone or call us back. They would just leave us short on the floor.
Berkeley East has racked up so many serious quality issues that regulators say it requires special oversight to protect residents' health and safety, and dropped it from an overall 4-star rating to 1.
Labs weren't being reported in a timely manner. Patients weren't given their medications on time.
She also alleges that during the pandemic, Aspen took steps to conceal staff shortages from the state health department by listing names of nurses who appeared not to be working there on internal staff reports.
These nurses were nowhere to be found in the system.
While Berkeley East operated at a loss, data from its most recent financial records show overall Aspen's facilities reported more than $27 million in annual profits.
Where do you believe that money was going?
It was going to corporate.
My mother-in-law wasn't the only one who felt ignored. On one visit, her roommate said she couldn't find staff to change her.
I have no idea when she's coming back.
Aspen Skilled Healthcare declined to comment for this report. It recently replaced managers at Berkeley East and has reported staff levels that exceed state and federal requirements. In a statement, an industry lobbying group said it supports financial transparency and accountability, but says these issues distract from others like chronic government underfunding and a growing worker shortage. Norah?
Lisa, thank you for your reporting.